My name is Nerissa Ko. I'm a neurointensivist and vascular neurologist, and I'm the vice chair for neurology in the Department of Neurology at the University of California, San Francisco. As we think about patients who've had an aneurysm rupture, often we think about the early brain injury and addressing those important things in the first 72 hours. What happens during the hemorrhage is that the blood gets into the outside coverings of the brain and becomes very irritating to the brain tissue as well as the blood vessels that live in this space. There's also a possibility of medical complications that can arise in the days subsequent to the aneurysm rupture, and we call this the secondary or delayed brain injury. Some of the things that we should be prepared to treat and avoid, if possible, are around hydration and fluid balance. Hyponatremia is also very, very common, and maintaining euvolemia is the most important recommendation to improving outcomes. We do know that hypervolemia or increased volume is not recommended and associated with excess morbidity in these patients. Similarly, hyponatremia is so common, and monitoring sodium and electrolytes together on a routine basis will help avoid making this a complication, and treating it early is also important in improving the patient's overall outcome. The hyponatremia after subarachnoid hemorrhage can be quite profound and require repletion that is extraordinarily high compared to our medical intensive care patient population. In cases like this, I've often used a combination of hypertonic saline, sometimes up to 100 cc's an hour, additional salt tablets per nutritional support, as well as fludrocortisone and other mineralocorticoids to support aggressive salt wasting in patients. In addition, the patients are also at risk for common things in the neurointensive care unit, including venous thromboembolism. We have a class 1 strongest recommendation to use prophylactic treatment, either mechanical or pharmacological, to prevent venous thromboembolism. Even in the case of a hemorrhagic injury like subarachnoid hemorrhage, it's important to initiate these types of measures to prevent a known complication.